Next, through the federal government's Health and Hospital Fund, we were fortunate to obtain funding for this building, as the Dean mentioned. We very much appreciate the investment in our university and in our hospital. The Honourable David Bradbury MP, member for Lindsay, was instrumental in helping obtain this funding, and with great pleasure I'd like to invite David to come up and address us.
Thanks very much, Michael. It's great to be here. Your Excellency, Minister Plibersek, Minister Skinner, Professor Robinson, Uncle Greg, also Patrick Cregan and Kay Hyman, His Worship the Mayor, Councillor Greg Davies, the many, many distinguished people that are here today. It's great to be here to see this project come to fruition. This is a project that goes back many years, and I can't pretend to have been involved in the project from its outset, but certainly I've been involved working in collaboration with many local stakeholders for the last 5 years. In fact, I wasn't even elected as a federal member and I was being lobbied on this project. As I think you saw from Bruce's comments earlier, I'm already, along with others, being lobbied for the extension to this particular project. So never miss a beat there, Bruce, but thank you very much for that. But I would like to take this opportunity to acknowledge the University of Sydney for their commitment to ensuring that Nepean Hospital continues to be a teaching hospital here in our region. That has been a significant thing for our region, and this particular facility here builds upon that outstanding partnership and history that we have, and that really does, in my mind, entrench that partnership for the future. So that is something I wish to acknowledge. Can I also take the opportunity to acknowledge Professor Michael Peake, who I've worked on a couple of projects with Michael in the past. In fact, he delivered our eldest daughter.
It's a project.
Can I say that this project has had a longer gestational period? On this occasion, Michael was the one doing the heavy lifting at conception. I just merely had a hand in its delivery. So here we are today to see, at last, after those many years of hard work and collaboration, what I think are some of the finest facilities of any institution, any clinical school in our region. We have that here in Penrith. I'm very proud to see that. That's something that will be a great boost to our local community. And I want to just very briefly talk about the benefits. I think there are essentially 3 categories of benefits. The first one is the benefit of giving us the opportunity to not only continue to attract high calibre medical professionals, but to help to retain them. I often think of that line in Kevin Costner's movie where they say, build it and they'll come. Well, in a sense, we didn't have any trouble with people coming, but build it and they'll come and hopefully stay. And I think that's what we would like to see. And I know that we've got some outstanding students that come here and are learning at the hands of some very high calibre teachers and professors. But I do hope that the long-lasting legacy is that we have within our region those professionals staying for even longer. The second category of benefits that I think flows from this particular initiative are the benefits to local health consumers, the people of our region. One of the great initiatives that's a part of this proposal is that there will be bulk billing facilities available for specialist services. It's an arrangement that I know Michael Peake was very much instrumental in devising. It's one that says that to specialists and other clinical professionals, some space will be made available to you at this facility on the basis that you provide that contribution back to the community in bulk billing your services. That will be a great benefit to our local community, and I think that is certainly something we should acknowledge today. The third, and equally as important, type of benefit that I think flows from this facility is that this gives us the opportunity to build upon the emerging platform of research capability that we have here in our region. This is something that is critical for helping us to address those challenges of the future. And I know that in key areas that affect our region, whether it be in obstetrics, issues such as diabetes and their impact, obesity on the community, I know that these facilities will help ensure that the good work that's been done in that area will continue to be done with even greater vigour into the future. That, Bruce, is my win-win-win. I think there are many benefits that will flow from this. It's a very proud day for us all to be here acknowledging this coming to fruition. It's also my opportunity to introduce and to welcome the Minister, the Honourable Tanya Plibersek, who is the Minister for Health. And I wish to acknowledge Tanya's ongoing efforts in supporting health in this region. She has been in the job for a relatively short period of time, but she's already made, I think this is about her third or fourth visit out into the Penrith area. So she's been in the role for just over a couple of months, and she's been out here a number of times. I must say that to the Governor's great credit, she's clocked up a few frequent flyer points coming out to this area in the past, and that's something that we very much welcome as well.